Question 1. A 5-year-old boy is brought to the clinic for recurrent sinopulmonary infections. On examination, he is unsteady when walking and has visible small dilated blood vessels on the sclera. Laboratory studies reveal low IgA, elevated AFP, and lymphopenia. What is the most likely underlying cause of this patient's condition? A. Defective recombination activating gene. B. ATM gene mutation. C. Defective NAPH oxidase. D. STAT3 gain-of-function mutation. E. BTK gene mutation. Correct answer B. ATM gene mutation. The child has the classic triad of ataxia, telangiectasia, and immunodeficiency, low IgA. Elevated AFP and ATM mutation confirm the diagnosis of ataxia telangiectasia. Why not the others? A. RAG defect, T B-cell recombination failure. C. NADPH oxidase, chronic granulomatous disease. D. STAT3 chronic mucocutaneous candidiasis. E. BTK mutation, brute tongue gamma-globulinemia, no B cells, but no ataxia telangiectasia. Question 2. Which of the following laboratory findings is most characteristic of ataxia telangiectasia? A. AFGE. B. AFP-IgA. C. AFP normal immunoglobulins. D. IgG. Normal AFP. Correct answer B. AFP-IgA explanation. Elevated alpha-fetoprotein, AFP, and IgA deficiency are hallmark findings in ataxia telangiectasia. Other Ig classes, IgG, IgE, may also be decreased. Why not the others? A. AFP is increased, not decreased. C. Ig levels are abnormal, especially IgA. D. IgG is often decreased, not increased. E. IgA is decreased, not increased. Question 3. A child with recurrent infections, progressive ataxia, and telangiectasias is diagnosed with ataxia telangiectasia. Which of the following clinical recommendations is most appropriate? A. Schedule a baseline chest X-ray every 6 months. B. Begin live attenuated vaccines for protection. C. Monitor closely for signs of lymphoma. D. Treat with corticosteroids to delay neurological decline. E. Use high-dose radiation therapy for any malignancies. Correct answer C. Monitor closely for signs of lymphoma. Explanation. Patients with ataxia telangiectasia have an increased risk of malignancies, especially leukemia and lymphoma. Vigilant monitoring is essential. Why not the others? A. Radiation sensitivity is high. Avoid unnecessary X-rays. B. Live vaccines are contraindicated in immunodeficient patients. D. Steroids are not effective in halting neurological decline. E. Radiation is contraindicated due to DNA repair defect and sensitivity. Would you like these questions